In regards to the shoulder, women that are entering perimenopause or menopause, the lack of estrogen is an anti-inflammatory. So what will happen when you're in menopause is you're going to have a bit more of a feeling of inflammation. So the joints are cranky. In regards to the shoulder or frozen shoulder, inflammation there in the capsule, but it could also be what's happening at the neck. Okay, the nerves that come out, they're impacting the shoulder, they're impacting the trap muscles. That impact is going to play a role on how the shoulder blade moves on the rib cage. That plays a role on how the shoulder or the upper arm moves in the joint. If there is issues with the shoulder and you never did anything, maybe you need to look away from what's happening at the shoulder. And that's where that good hands-on therapist, physiotherapist is going to come in. We have to do all we can to reduce that inflammation and really keep the joint as healthy as possible. But we also have to keep the cervical spine healthy. We have to make sure the rib cage can compress and expand, and the scapula, the shoulder blades, can move well on the rib cage. The rib cage, the thorax, which really is a very, very critical part of the body that impacts movement elsewhere. We have to appreciate how the shoulder blades move on the rib cage. They're able to elevate, depress, retract, protract, tilt. The position of the rib cage may limit that motion, which plays a role with the shoulder. The head of the humerus or the upper arm in the socket in the joint, if it doesn't have the ability to raise, reach behind your back, rotate back, for many people, they say, I never did anything. My shoulder is just bugging me. Look elsewhere. 2 breathing strategies just to work on expanding the chest, expanding the upper back. An example, if you are somebody who has that center of mass pushed forward, if your rib cage is forward, you're going to have more compression. Is it something else in the body that's impacting how that joint moves? First position is laying on your back. Do not overthink this. Lay in a comfortable position as long as the neck and the head isn't strained throughout breathing. Exhale without forcing a crunching feeling. The bottom of your rib cage should feel like it kind of floats downwards towards the floor. Hands on the bottom of your rib cage should help you recognize that feeling or that repositioning. Then take your elbows, drive them into the ground. As you inhale, think about expanding the air into the upper chest. So air is flowing into the chest, sideways into the rib cage. That expansion of air is helping us to get out of a compressed position in the chest. Second breathing strategy, forearms against the wall, palms face you. You want your elbows in line with your shoulders. This is important because we're expanding a specific area into the back. Same goal on your exhalation. We want the bottom of the rib cage to drive down and back. On your inhale, you should feel the air expand in the upper back. This is also helping to shift the rib cage backwards and allows a better position for the shoulder blades to move on the rib cage. If the shoulder blades can move well, the shoulder can move well. The more breaths you take, the more opportunity to feel the change or feel the expansion in the area needed.